You know that burning feeling you can get in your stomach? Well, it turns out it's often the sign of a full-blown microscopic war. In this explainer, we're going to dive right into the science behind that battle and explore the really clever ways we've learned to fight back.
So what's really happening when an ulcer starts to form? I mean, it's way more than just a little sore spot. It's actually a critical breakdown in one of your body's most impressive and, frankly, totally unsung defense systems.
So at its core, a peptic ulcer is basically a breach in your stomach's armor. Just imagine, all those powerful acids your stomach uses to digest, a big steak, what if they suddenly got direct access to the sensitive tissue underneath? Yeah, that's the acid pepsin attack, and that's what causes all the damage.
Okay, to really get a handle on this, you've got to picture this constant, high-stakes battle that's happening inside your stomach literally every single day. It's this incredible clash between two really powerful opposing forces.
All right, so on one side, you've got the aggressive forces, and the main player here? It's called the parietal cell. You can think of these guys as powerful little factories that line your stomach, and their whole job is to just relentlessly pump out hydrochloric acid to digest your food. This is the offense, plain and simple.
And then, on the other side, you've got the defensive force, which is just brilliant. It's the mucosal barrier. And listen, this isn't just some simple layer of slime, no way. It actively secretes bicarbonate to create this perfectly neutral little pH zone right at the stomach wall. It's an amazing shield protecting the stomach from its own acid that's just millimeters away.
So here's the crucial point, right? An ulcer happens when this perfect balance gets broken. The aggressive forces, the acid, they just overwhelm the defenses. And this usually happens because of one of two main culprits, either a nasty little bacterium called Helicobacter pylori or from the frequent use of NSAID pain relievers.
Okay, so we know what the problem is. How do we fight back? Well, the first line of treatment is kind of like immediate first aid for that damaged stomach lining.
First up, you've got the rapid responders, antacids. You know these. They offer really quick relief by doing one very simple thing. They just chemically neutralize the acid that's already in your stomach. The catch? They don't fix the underlying problem. And sometimes they can even cause something called acid rebound, where your stomach basically overcompensates and ends up making even more acid later on.
Now, another strategy is to just reinforce the defenses. And this is pretty cool. There are drugs like sucralfate that are actually fascinating. See, when they hit the acid in the stomach, they transform into this sticky gel. It acts like a physical bandage, literally coating the ulcer, shielding it from the acid, and giving it a chance to heal underneath.
But look, those are just first aid. For a much more powerful approach, we have to go beyond just dealing with the acid that's already there. We need to actually slow down the acid factory itself. And that's where the heavy hitters come in.
Okay, so we've got two main classes of drugs that slow down that acid factory, but they work in totally different ways. On one hand, you have H2 antagonists. They work by blocking just one of the signals, in this case histamine, that tells the cell to make acid. But then you have the proton pump inhibitors, or PPIs. They go right to the end of the production line, and they shut down the final pump itself. And that, as you can imagine, makes them way more powerful.
And the way PPIs are designed is it's so clever. You see, you swallow them as an inactive prodrug, so they just travel through your bloodstream, totally harmless, until, and this is the genius part, they reach the super acidic area right next to the proton pump. That acid is the key that flips the switch and activates the drug. It means it only turns on exactly where it's needed most.
And this right here is the final, decisive step. Once that drug is activated, it forms a permanent, irreversible bond with the proton pump. It doesn't just block it temporarily, it locks it down completely. It literally stops acid production in its tracks until your body can build a whole new pump to replace it.
So if we go back to our little battle map here, you can see exactly why PPIs are so darn effective. Instead of trying to block just one incoming signal, they go straight for the headquarters. They shut down the final punk that all the different signals are trying to activate.
And because they're so incredibly potent, it's really no surprise that PPIs have become the go-to treatment for a whole range of issues, way beyond just simple ulcers. We're talking about things like GERD, healing damage to the esophagus, and even preventing ulcers in people who have to take NSAIDs long-term.
But wait a minute. What happens when the problem isn't just an overactive acid factory? What if the real issue is a specific bacterial invader that has already breached the defenses?
Get ready for this number, 90%. An incredible 90% of duodenal ulcers are caused by just one single, spiral-shaped bacterium, Helicobacter pylori. This tiny organism is an absolute master at surviving in the stomach's incredibly harsh environment.
So, if you want a lasting cure in these cases, you can't just play defense. You need a full-on counterattack. It's called triple therapy, and it's a three-pronged approach. You use a powerful PPI to shut down the acid, and then you hit the bacteria with 2 different antibiotics to completely eradicate the infection. You're getting right to the root cause.
All right, let's bring this all together now. What does this all mean? Well, it all builds to a completely modern way of understanding how we treat this really common condition.
The big takeaway here is this. We've moved way beyond just popping in an acid for some quick pain relief. Modern treatment is all about being a detective. It's about figuring out the real root cause. Is it too much acid? Is it a weakened defense? Or is it a bacterial invasion? And once you know that, you can deploy the precise targeted strategy to fix it for good.
So the next time you feel that kind of discomfort, you'll know it's not just heartburn. It could be a signal flare from that complex and fascinating battle we've been talking about. And understanding the science behind it, well, that empowers you to ask the right questions and to really get what's happening on the inside. So is it just a feeling, or is it a signal from the battle within?